pros and cons of choosing an epidural with labor? I'm a 5 epidural woman, actually 6 because we had to do one twice. So.
Well, I think the pros and the cons for many, the advantage of an epidural is that it takes away the pain. Mm-hmm. And I always tell women, because there's some women too who, it's almost as if they're feeling guilty if they choose to do an epidural. And I always try to remind them that there's nothing else in the human experience at all that hurts as bad as labor that anesthesia is not offered for. Mm-hmm. And so again, no one should ever feel guilty about wanting an epidural. It's a wonder of modern medicine. And at the same time, no one should ever feel like they're being pressured into having one. Mm-hmm. If they don't want to have it, then that's their prerogative, and that's great. But the advantage of an epidural is, of course, that it takes the pain away. It allows the woman to rest during labor. Sometimes it even helps the pelvic floor muscles relax. There are some women who may try without an epidural, and then as soon as they get one, it relaxes enough that they're able to deliver. So that's the main advantage. Now, the main disadvantage of an epidural, of course, is once you get one, you're confined to bed. You can't get up anymore. You have to have a Foley catheter to help keep your bladder drained during labor. And sometimes, especially in first-time mothers, it's difficult to know how to push. And so we have to do a little bit more coaching to help them really focus their pushing to make it effective to deliver the baby. And so, the advantages and the disadvantage of the epidural are the same, and that is they take the pain away. And they also take away, for many women, that God-given urge that says it's time for me to push and no one's going to stop me. So when you talk about some of the other things that lots of people get concerned about nerve damage and all these things, those things are phenomenally rare. And in today's world, I don't even know if I can remember anyone who's had any permanent damage from an epidural. They're very safe. They are safe. They are effective. And everyone agrees that any woman who is laboring should at least have the opportunity to have one if she wants it.
Yeah. I know I was sure grateful.
Yeah. Well, in the United States, it's at least 75% of all laboring women get it. And there's still probably another, 10% who wanted it, but delivered so quickly or whatever, they couldn't get one. Mm-hmm. There's very few things, some women will have low platelet counts or other things that may not allow them to have an epidural. And so there's very few reasons why someone medically can't have one, but.
Okay. Yeah. I mean, I've known a lot of women that have lately, I've heard it even more so, that have chosen to go without the epidural. And I'm like, wow, you're a rock star.
Yeah. And there is probably a little trend for that now, for some more, hypnobirthing or some other things that some women try. And I, like I said, I support them either way. And I think it's great. I think the most important thing is just the woman being educated and feeling comfortable and not feeling that she's coerced into anything. We also have times where these women are there and for sure that they're doing this natural childbirth just because their mom or their friend thinks they should. And anyway.
Yeah, that could probably add a whole nother dilemma to the whole thing.
Exactly.
For sure. I'm sure there's those women too that I'm going to go natural and then give them a few hours and they're like, I think I changed my mind.
And they change their mind. And of course we try to make sure that they're not going to have any, feel guilt or anything about that. Like I said, there's nothing else that hurts as bad as labor that we don't offer anesthesia for.
Yeah. I love that. I haven't had it told to me that way before. That's really cool. All right. So is there a time frame that you recommend? So say a woman's been on the pill and she gets off the pill and wants to get pregnant. Do you recommend that they wait a month or two to let the pill get all the way out of their system, or is there?
Yeah. Pills don't take that long to get out of your system. But what we usually tell people to do is wait for one completely normal cycle off the pill before they try to conceive. And that's mostly because of dating a pregnancy. There's nothing really harmful from the hormones in a pill. but it can sometimes delay ovulation for a week or two and things like that. So sometimes dating the pregnancy is a little bit more difficult. So after hormonal contraception, oral pills, we usually tell people to wait for one completely normal cycle off the pill.
And what about IUDs?
And the same thing. So once we remove an IUD, they should use birth control till they've had a completely normal cycle. And that's just to make sure that their uterine lining, the endometrium, has had a chance to get back to normal. So yeah, one normal cycle. The other one, the ones that you have to really prepare for are the women who are using the injection, the Depo-Provera. I usually tell them to come off that about 6 months before they want to get pregnant and move to a shorter acting contraception like a birth control pill, just because some women will take a long time before they can ovulate after that.
Oh, okay. That's good to know. How important is your diet when you're pregnant, do you feel?
It's important. And we will always counsel women, and it's nothing different. I mean, you should eat during pregnancy like you should eat any time. Mm-hmm. And that is fresh fruits, whole grains, vegetables, meat sparingly, and fast foods rarely. And
I like that.
and then of course exercise is important. We're really emphasizing exercise a lot more during pregnancy. We're encouraging 150 minutes a week at a minimum of aerobic exercise, assuming no complications, obviously. But the thing with diet is of course what every woman gets concerned about is how much weight they gain, and then just so much concerned about how they're going to lose it after the pregnancy. And obviously the most important aspect to weight gain during pregnancy is how many calories are consumed and how many calories are burned off. Mm-hmm. Pregnancy is not a time ever to diet to lose weight. If you are pregnant, you should never diet to lose weight. But following a good diet is appropriate. And we have some women who may have started out their pregnancy overweight, and then they're motivated by the pregnancy and they follow a better diet and they lose some weight initially. That's fine. If you're following a good diet and you lose weight because you start out overweight, that's great. That's fine. But no one should ever say, "Oh my gosh, I gained 10 pounds last month. I'm going to diet now to lose weight." You should never do that. You should just eat a good diet and have a good exercise schedule, and your body will do what it's supposed to do.
And eating a good, healthy diet obviously is going to help, because isn't there, what's it called when you can get kind of the diabetes while you're pregnant?
Gestational diabetes.
Yes. Mm-hmm. Doesn't it help with that, prevent that?
Yeah. So diet is important for that. Really, really limiting those processed carbohydrates and things like that will really help that. Some women, just in case though, some women just get gestational diabetes no matter what they do. Okay. And so they shouldn't have said, "Man, if I would have eaten better, that wouldn't happen." Some just get it. Mm-hmm. But it does help, so if you're following that good whole food, whole grain, fresh vegetables, fresh fruits, if you're following that diet, it's not going to be, if you get it, it's just going to be because that's the way it is.
Mm-hmm. Okay, that's good to know. All right, so when I was one of those lucky souls that I had the Hyperemesis Gravidarum.
Yeah, lovely.
So back when my baby's 16 now, so back then, my doctor never gave me that term, but I was in the hospital with all my kids with IVs. My last one, I finally convinced my doctor to let me have a at-home nurse so I could be home with an IV. Have they done more research on what that is caused from? Because I know several more women now who have had that as well, and I just told people I was allergic to being pregnant. So. We still don't have a good understanding of why some women get so sick and others seem to be lucky enough not to. Yeah.
It again is not, believe me, there's been lots of studies. There's been, they're testing estrogen levels and, all these things and trying to see if there's something, and there's nothing. The hormone levels between women who get really, really sick and those women who everybody hates that don't get sick seem to be the same. It does seem to be a repeating thing. Just some people get it and they get sick. Now we have improved some things a lot, I think. You were talking about being admitted. I probably admitted in my time here, I probably admitted 3 or 4 women total for that, because now we have the infusion clinic, things like that, where they're able to go in and get an IV just as we order it, so they can go in anytime, and it's open 7 days a week. And home health is a little bit more difficult because the woman has to prove that she's homebound before they will do that. But with the infusion clinic, it makes it much, much nicer.
Yeah, that would be nice.
We just try to keep people, motivated enough to know that even when you're feeling so cruddy, your baby is still doing great. The baby still gets what it needs, but it is important for the hydration, and so that's nice. But we have all the way from the infusion clinic to some women have it so bad that they have to get feeding tubes just to get nutrition in that way. Yes, we've even had to do TPN and other things for someone who get really sick, but at least most of the time we're able to keep them home.
Oh, yeah, that was, having to keep going to the hospital was not fun.
No. And it's stressful. You got other kids at home and everything, and so it's much nicer.
For sure. Okay.
But there are other medications that are better now.
Yes, they came out with Zofran. Was it Zofran that they approved right after I had my son as baby? Right after they approved that. I just had the Phenergan. Yeah. And I couldn't keep it down, so then I had to use the suppositories.
And that's lovely.
Oh, it's a mess. So miserable. Yeah. I don't know how I had 5 kids. Anytime I've had the stomach flu since then and I've thrown up, I'm like, I don't know how I did this.
Yeah. Fortunately, again, and I don't know what your situation is, because some are lucky enough to hold on to it. Fortunately, again, if you can just get through that first trimester, get into that 14 to 16 weeks, most women feel better on their own. Some people don't. And again, we don't know why, but most people do feel better.
On a few of mine, I felt a little bit better. Usually it took me about 20 weeks. Mm-hmm. But on 2 of them, I was sick all the way through.
Yeah, that's just miserable.
Yeah, it's no fun. So I was grateful when my daughter got pregnant. She did not get what I had.
Good.
I was super grateful for that. Was been like a fear of mine. I was so grateful. So, okay, now I want to talk a little bit about just women issues in general. Let's see. Okay, we already asked that one. What is an oblation? An oblation, and the benefits and the cons, and who would be a candidate for this?
Okay, so endometrial ablation is a nice procedure that we have now. It's been around for many, many years. However, they just had some technology that's allowed it to be a lot more technically easier. I don't know what the right word is. Back in the day when they first were introduced, we used to have a little 3 millimeter ball on the end of this long device that we put in through the hysteroscope. And a hysteroscope is a camera that we can look inside the uterus with. And then we basically just kind of had to mow the lawn with this little thing. And so obviously you could miss things that way. But now the technology is such that it just kind of, all the devices that are out there now kind of, circulate the whatever energy or whatever they use to do the ablation, so it's much easier to get a good global burn of the endometrium. So the women who would benefit from an endometrial ablation, number one, again, it is something for women who are through having kids. You can't do it when you still want to get pregnant. Number two, obviously you don't want to just do it for no reason, so they need to have, their periods need to be bothering them somehow, whether they're so heavy they become anemic, or heavy and enough to where it affects school, work, motherhood, things that are just keeping them from doing what they need to do. And they're really nice in that they are an outpatient procedure. The recovery is so much quicker than a hysterectomy. And so the real intent, of course, of an endometrial ablation is to keep some women from having to have a hysterectomy. And an endometrial ablation is successful in a properly selected woman 90% of the time. With about 70% of women not having any period again, and another 20% maybe with cyclic bleeding, but it's so light that they're still happy. Some women who aren't good candidates is if they have an abnormal uterus. They have fibroid uterus, they have an abnormally shaped uterus, things like that. Those all increase the failure of an endometrial ablation. So an endometrial ablation, you need to have a relatively normal size uterus, a relatively normal shaped uterus, and then with that, they're great. They don't work for everybody. And unfortunately, again, just like with everything else, the only people who talk about ablations are those that it didn't work. And so then it influences so many other people. But when you look at all the numbers, it's 90%. 90% of women are happy with that procedure. But it basically, again, just burdens the inside lining of the uterus, the stuff that builds up and sloughs off when you have a period, and it burns it to a depth that it doesn't come back. And so that's what it's supposed to do. So it leaves the uterus intact. You don't have to go through the risk of a hysterectomy, but you have the benefit, hopefully, of decreasing the problems of a heavy period.
Is it permanent then, or does it eventually have to get it done again?
We hope that it's permanent, but some fail.
Okay.
You know, some will eventually bleed after some time, whether it failed or whether, again, something has changed with the uterus or something like that. But the intent of it is to be permanent.
So is the only time you'll do an ablation is, you said they should be done having kids, but what, do you want something permanently done before, like does the husband need to have a vasectomy or something before you? Okay.
Yeah, we hope that a woman has a very, very reliable form of birth control. Now, obviously, tubal or vasectomy are great. I've had a few women who are very, very motivated and tell me that they're religious with condom use and things like that. And of course, we counsel them strongly because a pregnancy after an ablation is not good, never good. And but yeah, so you want them to have a reliable, reproducible, whatever word, form of birth control.
Okay, awesome. And this would be a good alternative then for those women that struggle with super heavy periods or a reason to need to get a hysterectomy.
So this is treating women who 10 or 15 years ago their only choice would have been a hysterectomy.
Okay, all right, that's good. What is your suggestion with women who have severe PMS? the $1 million question. Every husband wants to know.
Well, PMS or PMDD or any of these terms that go along with these mood disorders or whatever that seem to be cyclic, that seem to be associated with the period. Again, there's no difference. They've looked, why do some people get it and some people don't? We haven't been able to find any reliable difference in hormone levels or any of these other things. There's not a very big line, if there is a line at all, between some of these and clinical depression. Many women who have had depression may be more at risk for premenstrual syndrome or PMDD or any of those things. So when you look at treatments for them, and of course we always start by saying, everybody needs to eat good, exercise regularly, and sleep good. Those things need to happen. And then if those things don't give the relief, and again, we don't want people thinking that this is something that I can work through on my own. I don't need to go see someone. I can, because it does. There are many women who need some type of treatment to be able to restore what they need to do to accomplish what they need to do. So I don't want, I shouldn't have started that way, because I don't want people saying, oh yeah, that's all I got to do and then it's going to be better. But in addition to any treatment we may prescribe or recommend, those things should be done.
Okay.
With the diet, exercise, and sleep. There have been lots of things looked at for PMDD. They've tried to do things where you can treat just during the time when the woman's having symptoms as a group. And there's lots of things that are evolving, and there may even be some things out there that I haven't even started prescribing yet. But as a group, the things that have been preserved just for when symptoms are there have not worked great. Either the side effects of these medications are too much, or they don't get the benefit. And so many of the treatments for these cyclic mood disturbances are still daily medications that are taken throughout the month, because we know that they are neurotransmitter related, and it's very hard to do something on the short term when you're talking about that type of an issue.
Okay, that's good to know. So I mean, of the studying I've done, like you said, there's the need for medication and having a doctor help you through things for sure. But really, diet, exercise, and sleep, like you said, can have effect.
Oh yeah, and they should never, again, I try to tell people again that anything that we prescribe needs to have those other things. Yeah, because that's just psychologically, daytime, we always go through some of these things. Humans are meant to sleep at night. Nighttime sleep is the sleep that restores us physically and emotionally. Daytime sleep does not do that. So we always try to tell people naps, okay, a 10 or 20 minute nap, whatever, that's one thing. But, naps should not be a regular part of your sleep. We're supposed to be awake during the day and supposed to sleep during night. So nighttime sleep is good. Daytime sleep is not recommended. So regular hours of sleep and to have as regimented schedule as possible, trying to get to bed about the same time, trying to wake up at the same time, trying to eat meals at the same time, try to exercise around the same time, and just telling controlling your body and telling it, here's when we eat, here's when we sleep, here's when we rest. But again, in today's world, not everybody can have that schedule, and it may not be realistic for everybody, but it should at least be a goal as just part of the overall treatment.
I think this is really important for women to hear and understand, because we as women adapt. We adapt and we give, and we have a problem receiving and giving back to ourselves. So we become depleted.
Right.
And that's what we work with in my membership, is helping these women. It's okay to give to yourself. Make sure you're taking care of yourself. Fill your own wells, because then you'll be able to give more.
Absolutely.
So that follows right along with that. And I did have a client that asked, she wanted to know what she could do for anxiety besides medication, and does diet play a part, or is there supplements that could help with anxiety?
Well, when you look at supplements, you can go to any health food store, and I never discourage women from doing that. You can go to any health food store, and there's lots of supplements that help. Again, I would try to say that those should just be adjuncts to a good diet and good exercise and good sleep. And so again, don't depend on any supplement to take the place of any of those health habits that are way, way, way more important. Now, of course, we as humans, we have things that cause anxiety. And that's another thing that's important for people to understand, is that anxiety-provoking things are not necessarily treated, nor should they be treated. Stressful jobs, stressful relationships, of course, you can get further and go into abusive relationships and all these things. Sometimes things need to change and not just be treated. And so anxiety can be a warning sign of something that needs to be done. But again, what we're talking about here is that unexplained anxiety reaction where we're saying, why am I worried and anxious right now when this is so out of proportion to what I should be? That's what we're talking about.
Okay. Yeah. Sweet. They're going to love these answers. They're going to love this case. So another one that came in: what causes low libido in women? That's probably the other $100 million question that every husband wants to know.
Well, and again, this is a hard question, and it's difficult to answer. But we always start by saying that number one, women and men are different.
Very.
and,
Very.
and when you look at the hormone of libido, the hormone of sexual desire, it's the same in men and women, and it is testosterone. But men have more testosterone than women. And so there is a big difference just in some of the normal physiology and things like that as far as that desire goes. Now, but that is usually not a critical thing. Most women, again, who suffer from low libido are going to have normal testosterone levels. So there's so many things that go into that. Far and away, as humans, our most important sex organ is our brain. There's no question. Now, that's not to say that this low libido is all in your head. That's not what I'm trying to say at all. But this is another place where women and men are a little bit different, in that women are always concerned, way more concerned with what may be outside the bedroom door than men.
Yes.
And so, you know, women are always going to be concerned about, well, I've got to take so-and-so to the doctor tomorrow, and oh, the kitchen is dirty, and you know, all the whatever things. You know, I've got this presentation at work tomorrow. I've got all these things, and it's much harder for a woman, normally, physiologically, to switch that gear. So that's important to understand. And many, you know, I have many patients who the only time that they really feel like that they're able to, you know, have desires when they're off on a vacation, all on their own with their husband, no other distractions, and they say, yes, I can finally relax and not worry about all these other things. Mm-hmm. But then, of course, they're worried about who's taking care of the kids. And all that. Now, there are some other things that happen, though, that are physiologic. We know that that there's no way a baby should fit out from where it fits. Yeah. When a baby is delivered, that does stretch tissue. It stretches nerves. Nerves do not heal normal. And when you look at a sexual response of a woman who's had children as compared to one who doesn't, we know that nerve conduction is different. There's all kinds of different things. So the other thing that is important is there does need to be more transition. There needs to be more foreplay. There needs to be enough time for a woman to be able to relax and say, okay, this is awesome. This is an important part of our relationship. I'm able to relax. I love this person I'm with. Mm-hmm. And this is a good thing, rather than, you know, because again, you know, sometimes it gets to the point to where she goes, oh, here he goes again. Okay, I'll just do my thing, let it be done, you know, and then that just kind of keeps the cycle going. And so obviously it's important to talk. Mm-hmm. It's important to have frank discussions. Mm-hmm. And again, that's just important. You know, it's important. It's important to do it at other times than when sexual intimacy is being outside of the bedroom. Yes. In normal talking circumstances. Yes. About some of these things. Many men, again, this is one of those things like you're talking about. Women give, and so they just say, "Okay, this is my duty. Okay, here we go," and the man never knows, and that makes it worse. And so just being able to talk about it. But there are many physiologic things that go into libido. Let's face it. If you're a mother of 2 or 3 or 4 kids, you're exhausted. And when it's time for bed, you're very interested in sleep. Yeah. And so, you know, there are some things where some people have to do sex dates and, you know, some of these things to where they just know, okay, I'm going to be able to relax. I'm going to be able to just think about these things. I've got everything taken care of. It's all good. But even with that, you know, I need to say that some women still really suffer, and there are some things, and we can supplement with a little testosterone that helps a lot. And counseling is important. Many times counseling is important. So again, we just don't want a woman saying, "I'm the only person in the whole wide world that feels this. Everyone else is normal. I see Instagram posts of these people and hear all their great experiences, and therefore I'm the only abnormal person in the world." Yeah. Yeah.
Well, and we've talked about this a lot in our group, that for women, we do have to make it a conscious choice. Mm-hmm. We have to very consciously, because our subconscious isn't going to do it. Consciously, we have to make, okay, tonight's the night. And I know for me, so much of it is my brain. It is me getting mentally prepared and in the mood.
And there's no question that, you know, no woman is going to be in the mood for sex when she's got a test the next day and, you know, all these things. And that's important for men to understand too, is that you have to be selective. Yeah. And careful and conscientious and realize again that there are differences. Mm-hmm. There are differences.
That's so true.
And she can't be judged. You can't judge her love for you or whatever, you know, by how she responds, because there are just differences.
Yeah. Yeah. I like that. So true. We are very different. Very, very different.
Yeah.
Okay. The next one is on vaginal itching.
Yes.
So obviously that can happen without being a yeast infection.
Right.
What do you feel is the protocol? Is douching safe? Is douching something to go to? What can women do? And is there a way that you can, if you start having vaginal itching and it might be going to a yeast, that you can curb it at home with home remedies before it full blown?
Yeah. Okay.